Hi everyone! In this video I wanted to demonstrate to you the setup for a well woman exam. Now women should get a physical exam once a year, and the exam includes a breast exam, pap smear, and Hemocolt. Here's the tray that you would set up for the provider. We have here some lubricating gel for the end of the vaginal speculum. And you also need the light source that goes inside the speculum, which illuminates the interior of the woman. Some gloves for the provider, the 3 different brushes, right? So this one's kind of nice. It's used to remove any discharge from the vagina so that the provider can see the cervix more clearly. And then we have 2 different kinds of brushes that are used to scrape the cervix to get those cervical cells that we need for the pap smear. So once the provider has obtained those cells, they would hand you a brush. You'll take that brush from them and insert it into the ThinPrep bottle. Swirl the brush around about 3 times to get the cells off the brush into the solution. And you'll send this ThinPrep bottle to the laboratory for testing. You want to make sure on any lab specimen you send to the lab that you put the patient's name, date of birth, your initials, and the date. And then, so the provider will definitely do the breast exam first, then they would do the pap smear. The last thing that they would do is the Hemocolt. So the provider will get a stool specimen from the patient and they'll wipe down the sample in these windows, A and B. And then your job would be to turn it over and you would put down 3 drops. 1 drop in this window, that window, and on the control. And if the card turns blue at all, then that's positive for blood in the stool, and follow-up testing needs to be done for the patient to rule out colorectal cancer. So this is a valuable test as well. And besides this tray setup, we have the table that needs to be set up. You got to make sure to get the stirrups out for the patient so we can put the patient in the lithotomy position. I have here, this is a chuck to put out just so that there's more of a barrier between her and the exam table. And then we also have a chest gown we need to set out and a drape, right? So the chest gown would go on the upper half of her body with it opening to the front so that the provider can do the breast exam. And the drape, this would be used to cover the lower half of her body, just so she's a little bit warm prior to the procedure. And sometimes patients come in and they also need to be tested for STDs. So we have some STD tests that we should pull and have ready just in case the provider, sees symptoms of a possible disease. So this one is for bacterial vaginosis. And this one is for herpes. We can also test for herpes with a blood test. And then this one is for gonorrhea or chlamydia. We would get a discharge sample from the patient to put in here. But most of the time, we screen women for chlamydia and gonorrhea with their urine because that is the cheapest way to test. So I just wanted to give you a visual of that because that also might be part of your exam for the patient. And then it's always a good idea too just to put out some tissues and a toilet for them to clean themselves up after the exam. And that is it for our well woman exams. So if you have any questions, let me know. But looks like we're good. So thank you very much.